Hello, this is Dr. Lawrence Janowski, Medical Director for Sonata Aesthetics in Broomfield, Colorado. I've been an aesthetic physician for over 18 years, and in that time, I've honed various techniques to help patients overcome one of their greatest fears, a painful injection experience. I had a patient say to me the other day as I was injecting her, "Dr. J, I hardly feel anything that you're doing. You're like a ninja." And I thought to myself, wow, that's a really nice compliment. To be able to deliver painless or nearly painless injections is an art that I've perfected over many years. And now I'd like to share some of my techniques, tips, and tricks with you, courtesy of the Injection Ninja. This is Dr. Janowski, the Injection Ninja. I want to show you techniques that you may not have seen before to help your patients experience less pain and less bruising during their procedure. We want them to think of you as the painless injector and separate you from many others. I want to talk about something very, very important, which I see often injectors doing incorrectly. I want to talk about what I call the snap technique. This is how we inject, how we move the needle through the skin. Far too often, I see injectors moving the needle far too slowly through the dermis where it hurts the most. So I want to show you how to speed that up in a way that's really very, very impactful for the patient. I can't emphasize enough that not enough injectors are doing this properly. And so I'm going to demonstrate what I call the snap technique. This is how we move the needle quickly. And by doing so, we really cut down on what the patient is experiencing as far as pain during the procedure. So I will demonstrate this snap technique right now. Okay. So I'm going to demonstrate what I call the snap technique. The whole basic premise of it is that we want to move that needle quickly with just a flick of the wrist or even just the fingers to get that needle to go in. We don't want to push like this, and we don't want to move slowly. I see far too many people moving slowly, and this hurts the patient. So what we'll do is we'll simply inject our disc port in the usual locations, but I'm going to grab the tissue and then very rapidly we're going to inject. Okay. Once again, we're just going to touch the needle to the skin. Patient doesn't feel much of that, just the touch, and that's your starting point. We're not starting away from the skin, we're starting at the skin. And then with just a slight flick or snap of the finger there, it's going to go in quickly. And the key is to move that needle through the dermis quickly. So once again, we'll come over here, touch the skin, and move in. And you see I'm grabbing the skin as well. We'll do one over here. And once again, we'll touch the skin rapidly forward. This is not a full arm thing. We're not pushing the whole arm. We're just moving the fingers just a little bit like that. So with the crow's feet, I like to also use distraction techniques, either tapping or wiggling the skin or moving the skin toward the needle. So again, we're just going to touch the needle to the skin. We do a two-handed technique where we're moving everything toward each other. Another poke, like this. And then right hand moves quickly, left hand taps or moves the skin. So once again, we're going to use the snap technique around the crow's feet, 3 points, 1, 2, 3. And we're going to use a two-handed technique. Left hand is involved, right hand touches the skin very rapidly, moves through the dermis. You can push the product slowly, but you want to rapidly move that needle through the dermis while distracting at the same time with the left hand. This technique can be used with toxins or fillers, and I will demonstrate fillers momentarily. This is a great area where we can demonstrate moving that tissue towards the needle, but we start by touching the skin and then rapidly getting the needle under the skin. And then we can slowly inject the product. But the key is to move through the skin quickly. It'll be easier if you have numbing cream, of course. So again, we want to rapidly use the snap technique It's just a flick of the fingers, not of the whole arm. I'm going to turn you this way. And again, we can move that tissue right onto the needle, just like that. And we do it quickly. I'm going to do some in the lower lip. Again, left hand's involved. It's moving tissue towards the needle, but we're also advancing the needle rapidly through the skin. In conclusion, the snap technique is probably the most important technique that you may not be using for your practice. It really has a tremendous impact on the patient's experience. You want to touch the skin, move the needle rapidly, just with a flick of the hand, not with the entire arm, and then you can slowly inject your product. Use the left hand for distraction techniques. I have a separate video on that. And this will really revolutionize your practice and you'll become the painless injector in your area. This is the Injection Ninja, giving you tips on how to keep your patients happy with less pain and less bruising. Good luck.